Welcome back to Health Talk here on AETV Live with Ogaga Ekama. Dr. Chidima Wogo is our guest for today, and she has been enlightening you and I on cervical cancer. She has made us understand what cervical cancer is, their different types, and also told us and informed us on the risk factors and causes. So, by the way, what are the signs and symptoms of cervical cancer?
All right. So these signs and symptoms include, or rather what the woman experience, they include having unusual, heavier and longer menstruation. For instance, let me say your period normally runs 3 to 4 days, and all of a sudden you notice that it's now running for like 7 days, 10 days, even getting up to 2 weeks. So that's a symptom a person can experience. Then another thing is abnormal vaginal bleeding, which includes bleeding after menopause, bleeding in between periods, and bleeding after sexual intercourse.
What do you mean bleeding in between periods?
Okay, let's say your period usually comes on the 28th day of every month, for instance, like towards the end of the month. Then you see it on the 28th, and it's supposed to come at the 28th day of the next month. Then on the 15th of that month, you're now seeing another period.
Okay.
So that's bleeding in between periods.
Okay.
All right, that's the second one. Then another symptom is abnormal, foul-smelling, watery or bloody vaginal discharge. Okay. Then the person can also feel pain during intercourse. The person can feel tired, loss of appetite can be there. Then we also have pain. That's persistent pain in your back, your leg or your pelvis. That is part of your body between your abdomen and thighs. So these are the commonest symptoms that the person can experience.
So from the symptoms you just mentioned now, when someone starts noticing or observing this, what should the person do?
Okay. Then there's another symptom which I didn't mention, that is unexplained weight loss.
Okay.
That is, you're not planning to lose weight, you're not on any weight loss journey, and all of a sudden you're eating well and or you still notice you're losing weight. So if you notice that, what you can do is you seek help. That's seek medical advice. You're expected to go to your doctor or a gynecologist, to be precise. All right. So you tell them what you're feeling. It doesn't mean that if you have any of these symptoms, that means it's cervical cancer, but just know that it could be pointing to it, which will make them, after taking your history, they can now recommend the necessary tests you're supposed to do in order to rule out cervical cancer.
So now you've entered the next one. So diagnosis and the tests that can be carried out. What are the options?
Okay. So the two commonest tests we usually do to screen for cervical cancer include the human papilloma virus test and the pap smear. All right. So for the human papilloma virus test, it's usually recommended for ages 30 to 65. All right. And you do it along with the pap smear. That's the HPV test plus a pap smear every 5 years.
Okay.
Or you do a pap smear only every 3 years for ages 21 to 65. So from what I've mentioned, anyone that is below 30 years of age is not recommended for the person to do HPV test. So the HPV test from 30 years, yes, just pap smear. So let me repeat it again. That's 21 to 65 years. You can do a pap smear only every 3 years. Then ages 30 to 65 years, a pap smear plus a human papilloma virus test every 5 years.
Okay. So what's the difference? What's the pap smear like? Could you explain for us?
So it's just like taking a sample from your cervix. When you go to see your doctor or the gynecologist or whoever is going to take, your sample, they position you. There is a position for it. All right. Then they use there is a pack for it too, and there are necessary, tools that are required to carry out the test. So they take a sample in your cervix, all right, smear it somewhere and take it to the lab to view if they will see any precancerous cells or cervical cancer cells. So,
okay. Then the HPV test itself is to test for the virus.
Yes, exactly.
Okay. So before we talk about that, so what determines what is done, as it were? Is it the age factor of the patient involved that determines if it's a pap smear, or HPV test that is done?
That determines the,
What is done?
okay.
Pap smell or the HPV? I say, is it the age factor that determines that?
Okay. No.
Or is the symptoms that determines that?
We advocate for regular screening, even if you're not feeling any symptoms. All right. You don't go to do a medical check only when you're feeling symptoms. All right. It's advisable to go from time to time to check yourself. I've seen some patients that they're just okay, but they'll say, Doc, I want to do hepatitis B test, I want to do this test and that test. So that is what we always, preach about. We encourage people to go for the screening, even if you're not feeling the symptoms. So because the screening is important, it's one of the preventive measures. It's important because if everything is dictated on time, early treatment is usually very paramount. Like it will help you get better quickly and the treatment outcome will be okay than when it's diagnosed, when the thing has gone late, as in when it's now too late, it has spread to different organs of the body. So that's why screening is important. And it's usually from ages 21. Yes, that's when you're supposed to screen.